Good morning, everybody. It's Wednesday, March 4th. I know you're all having that Super Tuesday hangover for those of you who voted in the states that were up yesterday, myself being in California. Big time Mo for Biden, but today we're talking about coronavirus, doing a little update here. It's been a while since I've been able to cover it. I've just been busy talking about Super Tuesday and all the boring politics stuff. But let's take a look at the numbers real quick, and then we'll get into a couple stories. One of them was from a couple days ago that I wanted to cover. I just haven't had a chance to get to it. So you saw the numbers here on the screen, 93,574 cases, 3,204 deaths. Obviously, we know the numbers out of China aren't numbers that we're really going to consider as accurate because we know those numbers are not being reported in a manner in which they should. So all we can do is go off what we have here. Death rate is 6% now. You see here, I was looking at this other article. The WHO was saying it was about 3.5% globally. I was watching a documentary actually on India yesterday, and I was sitting there thinking to myself how bad it would be if Corona hit India, just because the population density, the disproportionality of individuals who live in poor areas, the lack of health care there and everything like that. So I was sitting there surprised actually with the way this thing has spread, that it hadn't hit India as hard as it had, say, South Korea or Italy, places that we consider more advanced. Taking a look at the numbers, and sometimes I've noticed this, sometimes when I look, depending on what time of the day it is, the numbers aren't updated for that particular day yet. So here you see Korea and China's numbers are updated, but Italy and Iran's numbers aren't updated. So South Korea had an additional 435 cases, but yesterday Italy and Iran had 500 plus or so. So we have to wait a little bit later in the day, my time, to get their updates. But you see Iran, Italy, Korea even came out of nowhere a week ago. These countries were barely even registering in terms of the number of cases. So it's really exploded there. You'd see 200, 300, then 500 cases all of a sudden, deaths happening. So those countries are really taking off, and it looks like it's taking off in Germany as well. I told you that India story for a reason. You're like, hey, what's this guy talking about? What's your point? So look here, 21 new cases in India yesterday. They previously just had 7. So and that's what I was saying, was if that thing gets out of control there, then it's really going to be problematic in my opinion. So those are the numbers we have now. Now let me talk about a couple stories real quick. This is one I wanted to talk about for a couple days. I just didn't get a chance. It was published on March 1st. It's a CNBC article. You guys know I pull a lot of my articles from there in terms of like the human finance side of things. But it says here, Seoul mayor sues South Korea religious group for murder and injury over spike in coronavirus cases. It's kind of disheartening when I read this because I get the panic, but we have to remember to keep the blame where it lies with the commies, right? The reality is that they spent the first week, 2 weeks really not letting anyone else in the country or even their own people know what was happening. I'm trying to understand it in a way. I mean, I guess they were just thinking, I guess they were hoping that it wouldn't turn into what it did. The fact that they withheld the information from their people and the global community at large is really what led to this outbreak. So for me to see a mayor trying to sue a group within their own country, it's disheartening to me because we have to remember where the ultimate blame lies and whose fault this really is. So we're not necessarily going to read this whole article. You get it here from the title itself, but I just wanted to bring that to everybody's attention. Now let me scroll through the article and see if there's anything of interest in here real quick. Here's something I'd cover. It's kind of the blame game, pointing the finger. So the mayor accused Lee and others, this gentleman Lee is the leader of the church group there, so he accused them of evading tests for the virus and for failing to take adequate measures to get members of the group to work with health authorities in preventing transmission of the infection. Park, he's the mayor of Seoul, he also alleged that the Xinjiang provided false information that obstructed the work of health authorities. Now, on their side of it, the religious group denied allegations that its members hid their attendance at worship service and carried out missionary work in secret. He further goes on to say the General Assembly headquarters of the Xinjiang Church called for an immediate ban on all meetings, worship gatherings, and access to its churches throughout Korea after it was confirmed that a believer in Xinjiang's Daegu Church had been infected with the COVID-19. So again, it's a finger-pointing, blame game, he said, she said. The mayor saying that they were being horrible, evading tests, failing to do this and that. The church, on the other hand, is saying, no, we took these precautions. So what's the reality? Again, it's disheartening to me that unless it's really true that these church individuals really tried to hide this, it'd be disheartening to me that country members would turn on each other in a moment of panic. So hopefully this thing kind of dies down and we can get to the bottom of this and see what really happened there, because I'd hate for people to try to use this as an opportunity to kind of create fear within the community and be divisive in nature. Trust me, we get enough of that here. We don't need to see it in other countries. There's a couple more stories I wanted to cover. These are from Al Jazeera today. First off, these are the territories here with confirmed cases of COVID-19. And you saw a lot of those on the list in the first segment of this video. You can take a quick look at the map there. Geography, I'm not going to say I know all of these countries, so I'll admit it. So in my last Corona video I did, that was several days ago, I was talking about how Germany was already calling for pandemic status within their country. And at that time, I think they only had 20 cases or so. But they had found cases where they couldn't track the origin, so they were sounding the bell early. And I was saying, oh, it was pretty wise for them to do so because obviously they had this kind of feeling that something was up with it. If they lost track of how they're able to figure out where the source came from, like where the original strain came from in individuals they were testing. So now just a few days later, they're up to 240 cases now, including 44 new cases yesterday. Now you see here the first death was reported in Iraq, a 70-year-old, and that's what they've been saying, and you all know this that are watching these videos. They say most of the people that are dying are between 50 and 60, 75, so older individuals. So Iraq got its first one, says his health deteriorated since he was first diagnosed. Now you see here Australia, they had to ration toilet paper. They're up to 39 cases there now. Again, for any country that's getting this and the public's getting wind of the potential run on stores and everything, then obviously people are going for the staples. Toilet paper, water, canned goods, goods that can be cooked easily, maybe like pastas and things like that. Obviously medications. To me, I would think maybe people would be buying cereal, other things like that that would last a while. Rice as well, beans, things that you can put up in a pantry, things that would last for weeks on end. In Australia, toilet paper. Makes sense, right? Now again, here's just another little story out of France. It looks like they're regulating the price of antibacterial gel. Now again, like we see in any kind of outbreak situation or any attempt where there's a possibility where prices can be jacked up for individuals to make money, then of course they're going to try to take advantage of it. So here, again, antibacterial gels, you would think that, again, like waters, toilet papers, face masks, medications, things like that. So again, it's just like all these little things, kind of like the little panic things, they start to add up and add up and add up in all these countries, and then the next thing you know, it's a big snowball. Russia suspends exports of masks, which again makes sense. If you have supplies and things like that, then you need to make sure that you are taking care of your individuals first here. I always say that. The point of any government within any country is to ensure that its citizens get first priority to the goods they produce. So I have no hate for any, I can't disown any country or have any hate for any country that does this when they're looking out for the best interests of their citizens. It says here though in this second paragraph here, it says, Russia has not reported any confirmed cases of people contracting coronavirus while inside the country. Those 6 people who got infected elsewhere have received or are receiving treatment in Russia. They also say above here, it added that the suspension would not affect exports being made for humanitarian reasons. So again, if they have things to spare, then they'll do that for humanitarian purposes. Okay, and then just a couple more things I'll cover here real quick. Further slowdown in China. It says here, China's data continues to show the outbreak there is slowing. Again, you can decide whether or not you want to believe those numbers or not here. It says the country reported 119 new confirmed cases to the end of March 3rd, compared with 125 the day before. And then one other thing I was going to talk about was the local news here. They were saying that, and then the last thing I wanted to cover on Corona for today was on the local news earlier today, they were actually talking about the subway system in New York City. So what they were saying was over the next 72 hours, they were going to be going through, this was, presumably at night after it had closed down and traffic had slowed down, but subway crews were going to be going through, wiping down everything, turnstiles, cleaning any kind of rails. I'd imagine they would be cleaning cars as well, wiping down seats, anything where individuals can be putting their hands, touching things, and they showed footage of them. They were going through bleach and stuff left and right. So what they were saying was just, over the next 72 hours, they were going to be performing this kind of work in the subway system, like I said, in New York. So individuals would just have to get used to the smell of bleach, and I think that maybe is something people would be good with. Peace of mind being what it is, right? Now, that's all I got for Corona today. I wanted to just keep it short, but just kind of put out a lot of different stories just to let you know the whole humanitarian side of it all and how different countries are reacting to different things, how different cities are taking precautions. Again, we see this thing spreading. South Korea, Italy, Iran. It looks like Germany, it's starting to spread. India, it's starting to spread. We'll see how these other countries in the Middle East and Africa are able to kind of hopefully keep things in check to where it doesn't get out of hand and become a situation like it did in Wuhan. Again, that's the video for today, so I'll definitely be talking about this more in the coming days, but thanks for watching this video, and take care and have a good day, everybody.